Hi guys, Nurse Nikki here from City Facial Plastics with Dr. Linkov. We're going to be doing a reaction video on Beginner's Guide, Getting Injectables for the First Time by Real Self.
I'm Susan, I'm 45 years old, I live in New York City, and I'm an event planner. Although I don't have makeup on now, I'm big into makeup and beauty products in general.
Okay, so one thing I have to say, I love when my patients come barefaced, like this beautiful woman. Please do that when you come in the office. It takes a lot of time to remove your beautiful foundation, and you need to keep it off probably for about 24 hours, I would say, after injections.
To trends or try new things out, but I haven't gone as far as going into anything more medical. My name is Dana Cathala.
So we can go back and we can start to look at her face and maybe and tell me what you think, what comes to mind when you're looking at her faces from like a rejuvenation standpoint. I'll give some thoughts as well.
Okay, well, I think definitely skincare plays a big role on it. I think she would benefit greatly from just a great skincare routine. And then, you know me, I like doing lips. So I think a little hydration in her lips would really balance out kind of the fullness that she's begun to lose. So I think that would be beautiful for her face.
Yeah, I mean, I would also add like the forehead has the lines that are starting to get more etched in. So I think introducing some Botox might be nice for at least the forehead and the glabella. The crow's feet really don't look too bad at all. So, that would be good. And then maybe even, as much as I try to avoid the tear trough filler, it might be something to consider in her case. Small amount might be helpful. Maybe some nasolabial fold. But otherwise, she has good cheek volume.
She does.
I don't think that should be augmented at all. And
good bone structure too. Nice jawline.
Yeah, and things are still fairly lifted. I don't think that there's been too much droop over time yet, so I would avoid any major surgeries for her.
Yeah.
That would be good.
I'm a board certified plastic surgeon, both American and board certified in plastic surgery and reconstructive. Besides surgery, I also do non-invasive procedures as well, such as injectables, fillers, and neurotoxins.
So from like a patient's perspective, and we've covered this before, but different people will do injections, and so at least from a legal perspective, I think you have to at least be a nurse or a PA in this in this state. I don't know how it is in all states, but I don't think you can be like an esthetician and do injections. I don't think it's allowed here. Yeah. So then so you have nurse, PA. Sometimes it'll be the physician who does injections, but the backgrounds of the physicians can be quite variable. Right. So sometimes it can be like a general medicine doctor, and other times it's a board certified plastic surgeon. So it's just good to know
credentials.
Credentials and their background. And it doesn't mean that someone with a non-plastic surgery background isn't a good injector. They can be great, but just have to, I think, know where they're coming from, what their background is, what their training is. I think it's helpful.
For sure.
So neurotoxins, they act differently. They paralyze the muscles, and they're used mostly in the upper forehead and around the eyes and in the glabella.
What do you think of this technique here for the neurotoxin?
That's actually how I first learned with my training, away from the eye, doing the crow's feet. I don't do that anymore because I'm comfortable with the needle now, so I can kind of go in with my markings. But I don't like using the facial vibrator. I don't like holding it. I like to, anchor my hand. I give it to the patient if they want it. Yeah. As a distraction. Most of them don't want it, but if they really do need kind of that ease, I give it to them to hold. I wouldn't hold it and inject with the needle for sure.
Yeah.
No.
So I think with this technique, you risk going too deep. The orbicularis muscle is fairly superficial. And at that trajectory, you're not really going to get to some of the deeper muscles involved with smile, but you can get to them if you're a little bit lower down on the lower kind of crow's feet area. And that can then lead to other problems like with smiling being affected, which isn't good. So I think the trick is to stay superficial. When you're using this type of injection technique where you don't have full control because you're just kind of one hand like in the air, there's going to be a tendency to go deep.
For sure.
And so that, and also I like to personally feel like the orbit, like the orbital rim, and just know where I'm at.
You need that second
It's good to be away from the eye, but I think it's also helpful to just know where the eye actually is and where it ends and all of that. So I agree with you on the second hand being helpful.
Glabella, which is the area between the eyebrows. As for fillers, it's where the depressions are, and the most common filler is the hyaluronic acid filler. It lasts from...
So I'm not really sure what they're doing with the vibrational thing there, because it's not so much for the pain relief. It seems like maybe they're massaging out the filler with it, or they're using that before they're about to do the filler. I'm not really sure, but usually the vibration like has to happen at the same time as the pain trigger, so that the brain gets tricked in a way to thinking that the vibration is there instead of the pain. So I don't know what that technique is.
I don't use it very often.
Yeah, the vibration. Yeah, we have it.
We have it.
Acid filler. It lasts from like 6 to 9 months depending on the area that is injected. The neurotoxins is for the function and the movement, and the other one is basically to fill an area where the fat, as a result of aging, has just kind of resorbed and become deflated. Hi, how are you? I'm Susan. I'm Dr. Gathala. Nice to meet you. How are you?
Great, thank you.
How can I help you today?
There's a couple of areas I've been thinking I have some trouble with, namely my forehead, sort of this scar depression here, but wanted to talk through it and see what you thought.
Have you had anything done before?
I've never had anything done before.
Well, let me see the scar depression that she's talking about. So yeah, she has an 11 line, glabellar line here, pretty much right in the middle of the glabella, and then she has this scar that's running on this like kind of angle to the glabellar line, which is from maybe an accident or something, or maybe a mole removal, or something like that. So it's a tricky area to improve. Have you seen kind of those types of scars before?
I have. Yeah, I've seen those scars before. I don't treat them with filler because it's a very high risk area, but I do soften the lines in that area with some neurotoxin for sure. In her case, I think, like I said, skincare, so maybe some microneedling just to soften the depression, but no filler.
Yeah, I agree. The supraorbital and supratrochlear arteries run relatively close to that site, so too high risk for blindness. I would also suggest maybe some laser resurfacing potentially,
Sure.
And sometimes like a scar revision is possible here to reduce that depressed appearance. So if you cut it out and you stitch it up well, usually you can get a cleaner surface. So there's still a line like linear scar, but then that can be resurfaced even further. It's hard with like laser when you have such a deep line, I find, to like really make it much better. So sometimes surgery followed by some resurfacing can be helpful. So let's see what she suggests.
That little toy again.
All right, I want to introduce you to this.
Oh.
This is a distractor.
Say hello to the distractor.
So basically, it vibrates to distract from the pain of the injection.
Okay, I love it.
And this is the Jeuveau.
I used Jeuveau for a brief period of time when they came out onto the market, and I found it to be very similar to the effects of Botox, but like basically they were offering it at a much greater discount than what Botox was at the time. And then I think there was like some legal action, and then basically they were told that they can't undercut Botox, at least for a certain period of time.
Okay.
So then I said, you know what, I'm just gonna switch back to Botox since they're the same
good old
price now.
Botox. I love it.
But it definitely worked.
Take from 3 to 7 days to start functioning, and they only last.
Hey, what do you think about that technique there for the glabella?
I like to anchor my hand. I mark first.
When you mark, what are you marking for? Like, what's your technique?
I
for
have
marking?
them make a really, I can't do it because I have product, but I have them make a really angry face, and I mark out the corrugators here, and then I don't go past that. And I usually put about 5 units in the middle, 2.5s, usually.
Yeah, I think a great approach is to just really mark out the corrugators first.
Yep,
and
always.
like basically trace them out. You can see the muscle. I mean, on pretty much everybody, you can see the muscle.
Yeah.
I just draw a line like where the muscle is.
Make a muscle. There you go. See,
Yeah.
right here.
Yeah.
I read the skin like a book, so
Yeah,
and every book is different. So
you can see the corrugators, so marking them out I think helps. And then usually when you have like a line, like a deep line, like an 11, that means that the muscle is spanning across that line. So on the inside, right? So my thought is always to inject on either side of that line.
Right.
People have a tendency to just see a deep line and just like go right at it because they're like, I'm trying to like get this line to go away. But it's more important to remember how your musculature looks and that you're addressing the musculature because that's what's actually getting paralyzed, and that's how you're affecting change. If you only go on one side of the line, well, now you have a portion of that muscle
Getting
that hasn't
stronger.
been it gets stronger and it hasn't been addressed. So
Lasts up to 3 months.
How do you feel?
Mildly distracted.
Just keep breathing. And this is where I'm doing your crow's feet.
what do you think of the forehead technique?
Like I said, this technique with holding the facial vibrator, I think it's more effective if the patient holds the vibrator, you're anchoring your right hand or left hand, depending if you're a righty or lefty. I like to cut the forehead in half. I actually mark it with my pencil. I don't go below that line because I don't want to risk getting that heaviness. I stay superficial.
How much clearance above the brow do you leave? As far as not going too low.
I usually just cut the forehead in half.
You mean which way? Horizontally or vertically?
Horizontally.
Oh, you mean, I see. In terms of the height of the forehead.
Right.
Yeah, I think.
Because I've had issues in the past to where, as far as dilution and everything, it spread more and people were feeling that heaviness in their brow. So I've just done it that way. I learned that way and I've never had a problem. So
I think leaving at least a centimeter between where you inject and then the top part of the brows, in my experience, has been fine as far as not depressing them.
Okay, so I'm going to open the Define. So it's a hyaluronic acid filler, and it's going to help plump up your cheeks.
Any thoughts so far on the injection technique there?
I just can't get over not anchoring your hand. I don't know. I don't aspirate in that area. I just stay close to bone and you should be okay. I mean, even her aspiration technique, the needle is moving, so there's no safety there anyway.
Yeah, I agree with that. Yeah, some people will aspirate every time and other people won't. I never aspirate and haven't run into any problems, but I think you can run into false sense of safety and security when you're aspirating and you say, oh, it's safe because I didn't get any blood draw, but then you might still be in a vessel when you go to actually inject.
Right, that's why it's important to anchor the hand and just know the anatomy. I mean, you have to stay down on bone in that area.
Medially, as we move on the cheek, the bone can sometimes feel like it's moving away from you and it can get pretty deep in there. So sometimes it's tricky to be on bone, I find, this far medial. Also, the infraorbital nerve is not too far. And so there's a situation where sometimes if you inject too much filler right around that nerve and the foramen where it actually comes out of the face, you can get a situation where people feel a lot of pain there because it's almost stuck within the nerve sheath. That is an unusual complication, but it's something that we have to be careful of and not to over inject around the infraorbital foramen.
Beautiful. Because you are helping me out with those beautiful cheekbones.
You're welcome. The distractor really works.
It does.
It does. So
I don't have
smart.
to numb anyone anymore.
No, it's
a
smart.
lot quicker too.
Yeah.
Take a look.
Yeah, it looks great.
No big, exactly.
Yeah.
I also have an old existing scar between my eyebrows that I think is either collapsing or something's happening to it, so it's becoming a lot more furrowed.
Okay, so, she's taking the approach of just putting filler in there. And, my concern is were the risks discussed with the patient? Because if someone told me I can put filler into that area, even if it's a 1 in, a million chance of blindness, I don't think I would take it personally. But some people might, if it bothers them enough, I guess.
I think you have to know your limitations as an injector. I don't personally inject foreheads. I've only injected 2 noses and I've been doing this for 3 years.
Yeah.
And I think they're happier when you're more transparent with them about the risks.
Yeah, and I think you and I have spoken that this is a growing trend, right, of people putting filler into the glabella, feeling more confident doing it, but the risks are still there.
All right, I want you to take a look.
I can barely even see it now.
Right?
Here. Yeah, that's crazy.
That's like a great
Right now. Now that it's all over, I definitely feel a little bit refreshed as opposed to having a whole new face or seeing crazy results. I think it looks like I just maybe got a facial or just had a skin brightening treatment or something like that.
So yeah, I've had patients who they leave after Botox and they're like, oh, I can see it already.
Yeah.
I don't know if you experienced that, but
Yeah, they always say that.
you want to tell people what the usual time course
Yeah,
is?
it usually takes between 7 to 10 days to start to work, 2 weeks to fully, get that full result. Yeah, I think they just feel better getting a treatment, especially people who have gotten it for the first time. They just feel more refreshed. And I think that feeling's a great thing. But then when you start to see the results in 2 weeks, I think then you're really kind of hooked on that and want to keep.
Yeah, some people as early as 2 to 3 days, they start to feel the impact, but it's definitely not going to be their final result. They just have to keep waiting. With the filler, it always causes some degree of swelling. So even when people are excited about the results, right, when they're in the office still, I think it's important to remind them that, hey, it's going to go through some changes over the next few days or so. Because there's some people who get I feel like too worried about the initial swell, and other people who they get upset when the swelling goes away because they're like, oh, that's what I wanted. So either way, it's going to change, and I tell that to all my surgical patients too, because they almost like overreact to the initial result that occurs right after their surgery, and it's just not how it's going to look down the road.
I love the initial swell. Thanks for watching, guys. We hope you enjoyed the video. Don't forget to like, comment, and subscribe, and we will see you next time.